All right, so what if I told you that during one of the deadliest epidemics of our time, the most important tool wasn't a vaccine, it wasn't some miracle drug, it was understanding people? Yeah, seriously. This is the story of how anthropology, a field many of us think of as purely academic, actually became a matter of life and death.
So, let's set the scene. Picture this. It's 2013. A really terrifying Ebola outbreak is just ripping through West Africa. And of course, the international community scrambles, right? They send in this massive response. Doctors, nurses, epidemiologists, everyone is laser focused on one single goal: stop the virus. But here's where things get strange. As the response got bigger and bigger, this totally baffling and incredibly dangerous problem started to pop up. Right in the middle of a deadly crisis, you've got communities that, well, they weren't asking for help. In fact, some were actively fighting against it. I mean, think about that for a second. Why would that happen? It was this huge paradox, and it was costing lives.
And this wasn't just a small issue, it was a massive problem. You had people secretly caring for their sick family members, performing traditional burials, both of which, unfortunately, are incredibly high-risk activities for spreading Ebola. So these actions, things that were meant to show love and respect, were actually and tragically fueling the epidemic. The responders on the ground were just desperate. They had to figure out why.
Now, the first answer that came to mind, kind of the easy explanation, was just one word: culture. The assumption was, okay, their local customs, their beliefs, they're just getting in the way of the science. But, and this is a huge but, that explanation, it wasn't just incomplete, it was dangerously incomplete.
So, on the surface, the thinking was simple. Culture's the problem. It's an obstacle. But the deeper reality, the one that anthropologists on the ground started to uncover, was something else entirely. Turns out, these behaviors weren't irrational at all. Far from it. They were often a completely logical response to, get this, a long, long history of mistrust with governments and with outside organizations. And this is exactly where anthropology steps onto the stage. We're not talking about studying so-called exotic customs here. It's way deeper than that. It's really the study of what makes us human. And it gives us this incredible toolkit for understanding the logic behind why people do what they do, especially when things get crazy, like in a crisis. Think of it like social detective work, for real. Okay, so how does this social detective work actually work? I mean, how do anthropologists manage to get past all those surface-level assumptions to find the insights that can literally turn a crisis around? Well, one of their most powerful tools is something called participant observation. And it's pretty much what it sounds like. Instead of just showing up with a clipboard and a bunch of questions, an anthropologist actually embeds themselves in a community. They live with people, they listen, they just observe daily life, often for a long time. This is how you build trust, and it reveals all these little nuances that a 10-minute survey could never, ever hope to capture. And let's be clear, this isn't just about collecting interesting stories. This is systematic work. It's this constant cycle of observing what's happening, analyzing it, and then refining your questions right there, in the field. You're constantly learning and adjusting. And through this process, you build this incredibly rich, layered understanding of the why behind what people are doing. So, okay, that's the method. But how does this deep understanding actually translate into life-saving action? Because, having these incredible insights is one thing, but trying to apply them in the middle of a chaotic, fast-moving public health emergency, that is a whole different ballgame. Basically, there are three main ways anthropologists can plug into a crisis response. First, they can help design the programs from the very beginning to make sure they'll actually work for the community. Second, they can be on the ground, in real time, helping the response teams navigate all the complex social stuff. And third, they can help analyze everything after the fact, so we can all learn and do better next time. Let's go back to West Africa for a second. Remember, that initial response was completely top-down. It was driven only by the hard medical facts. The virus spreads through contact, so the solution is quarantine and super fast, safe burials done by teams in hazmat suits. Simple, right? But things like local perspectives, people's beliefs, their sense of dignity, none of that was even part of the equation. And the initial result was, well, it was a disaster. As you can see here, this forceful one-size-fits-all approach just created more mistrust. It actually led to more hidden bodies, which meant more transmission. But then something changed. A critical shift happened.
Anthropologists started working with the response teams, helping them understand just how deeply important funeral rites were to these communities. And together, they figured out how to create burials that were both medically safe and culturally dignified. That collaboration, that was a turning point that finally helped get the epidemic under control. You know, this whole experience really changed the game for how a lot of people in public health think about social understanding. It stopped being seen as some nice to have or a soft skill. No way. It became what it always was, a form of critical, absolutely life-saving evidence.
And this quote really nails it. Epidemiology is absolutely essential, right? It uses data to tell us what the problem is and where we need to focus our efforts. But anthropology, it shows us the possibilities for action. It tells us how to design solutions that people will actually trust and, more importantly, accept.
So, when you boil it all down, the lesson from the Ebola crisis is crystal clear. A public health emergency isn't just a biological event, it's a social emergency too. And if we really want to save lives, we have to treat the social fabric of a community with just as much care as we treat the virus itself. We have to start with understanding the people.
And that leaves us with a really critical question for the future. Because look, we all know another global health crisis isn't a matter of if, it's a matter of when. So when it happens, are we going to remember these lessons from Ebola? Right from day one, will the social story finally be heard?